He'll be back. So while we're waiting for Dr. Larson to come, I have a couple staff members here with us, and I want to welcome everybody and appreciate you joining us today. These are what we're calling our chamber webinars or information sessions. So we invite people to join us purely for information and hopefully guidance.
I've never.
So let's see.
I think that worked, Mark.
Yeah.
Can you hear me?
I can hear you now.
Okay.
Okay, so as we start this meeting, we always ask you to be kind in your questions. We're here to just help you with information and be respectful. So if somebody's talking, just wait and for your opportunity to talk. I will try to moderate as quickly as I see that if you want to kind of chime in. So to start this off, we have asked Dr. Larson to join us for today's information session. There's a lot going on and we felt like he can give us an update and hopefully answer some questions. Prior to the meeting, we did have a link for questions to go towards Dr. Larson. He has those questions, so he's prepared to answer some of them. And what I'll do is I'll read them and then he can answer those questions. And as you know, Zoom has a chat.
I'm gonna have to step. I can't hear anybody here. So
Okay.
sorry, I can barely hear you. So I'm gonna move somewhere else so I can try to be not distracted.
Okay, sounds good. And so Zoom has a chat function. If you do have a question in the chat function, I will moderate the chat function and ask your questions as they come about. So again, thank you for coming and joining us. We appreciate the time that you spend with us, and we hope that these information sessions are worthwhile for you moving forward in this process. So welcome, Dr. Larson, and good morning.
Good morning.
We'll start with you just giving us an update for this morning if you would like, please.
Probably my update for today, and hopefully you can hear me better than I can hear you. We are in the process of waiting for our application for our variance to move into phase 2 of the Washington reopening plan. That variance application is on Secretary of Health John Wiesman's desk. And as of a few minutes ago, I've not heard anything back from Secretary Wiesman, but I do know that he was planning on looking at it last night. There are a variety of things that the health department has to be ready to do to move into phase 2, which really are more health department issues than they are chamber issues, but they include the ability to do testing of everyone that needs to be tested, a case and contact investigation, which is a standard public health protocol for any infectious disease. We have to be able to do isolation and quarantine of those people who are ill. The plan in Kittitas County is to encourage that to be done in people's homes, not in any kind of facility, but we have a lot of options in regards to isolation and quarantine. And then we have to be able to provide wraparound services to those people in isolation and quarantine. For example, if somebody is not able to get out to get food, or if somebody needs medications, or somebody needs social support in any way, we have to be able to provide those things. So those are the things that actually Secretary Wiesman is looking at in regards to the decision as to whether or not we are granted a variance to move into phase 2. It has less to do with people, with businesses' own plans to what they're going to do to safely reopen. So that is the understanding of the governor and the Secretary of Health, is that businesses will be doing their own, developing their own safety plans for their businesses, but it's not a requirement of the request for variance. Those are all public health issues based upon, as most of you know, the initial decision in regards to that had to be made by me requesting a variance to the Board of County Commissioners and the Board of Health. The hospital had to be willing to say they were ready for anything that might happen because of that. And we had to have partners buy in. We had to be a county of less than 50,000. Now that's been changed to 75,000. And we had to not have any cases of COVID-19 in the last 21 days. It's been difficult to use one particular metric to decide how to move forward with this. And here's a good example of that. So the metric is currently to move into phase 2, no cases within the last 21 days, which we met that metric, but then yesterday we got a new case. So does that mean, how is that really different to have one case at day 22 versus no cases at day 21? Well, it doesn't really make a big difference. And so that's why when people want the governor to have a number, well, it's really hard to have a number. So as you will probably hear today, because we're going to get a press release out, that particular patient actually was infected in Japan in February, has totally recovered, but due to some other health concerns, went into the doctor 2 days ago and whoever saw him said, well, we should probably test you for COVID. And the test was still positive, which is almost 3 months later. So the test can stay positive for a long time. So that's my update for today.
Well, thank you. So we do have, for those that just joined us, there's the chat function within Zoom. If you have any questions, if you weren't able to do pre-questions to Dr. Larson, please use the chat function so we can go through those. And welcome and thank you for joining us. Dr. Larson, if you don't mind, we'll just continue into the questions, and then as people use—
Welcome to Zoom. Enter your meeting ID followed—
We might have lost him, so just a minute.
No, I can still hear you. I was trying to log in on my other phone so I could hear you better, but I'll keep working on it. Go ahead.
Okay, sounds good. So please use the chat bar if you have any questions that comes up during the time that we are going through this process. So question number 1 was, Shoemaker rolled out a factory and campus-wide cleaning plan in the end of March after receiving the governor's Stay Healthy, Stay Home order that involves surfaces, equipment being disinfected during scheduled cleaning times at quarter to the hour every hour. We took a more proactive approach for our employees' health and safety, as we have been an essential business and able to work since the end of March and have kept the same cleaning routine and schedule. With there not being an established routine or guidance that we followed to establish this type of cleaning program, how can we start to phase back or ease up in departments and have our custodial staff take back on the bulk of the tasks?
That's a good question, and it's impressive that they had such a program in place as an essential business. Not every business that was considered an essential business was that aggressive in regards to developing a safety plan. I would say that there are documents on the Department of Health and the CDC's website in regards to what's required to be safe for businesses. And as you know, Amy, we have a group that's encouraging people to develop safety plans. I did happen to think about Shoemakers today in regards to the whole idea of testing, because as we have groups of businesses that might have a case, that we'd want to discuss with them how the health department might be able to come in and help them test people in a facility such as Shoemakers. So they will be hearing from me from public health in regards to how many people they have and how we might be able to help them should we have a outbreak similar to what occurred in the packing plants down in southern Washington. So I would be cautious about going back on safety plans just because they've done a really good job and they haven't had any cases there. But I don't have any specific directions, although I could look at their plan. I'd be happy to do that and say, oh, this is probably not necessary. So maybe the thing to do would be to have them send me their plan and I could say, oh, this isn't needed, or maybe you can do this instead.
We'll follow up with them because I'm not sure if there's a representative. I don't see anybody that I recognize from them. So we'll follow up with them with that suggestion. Question 2, as we move to phase 2, who will be in charge of making sure each business is following the rules?
Yeah, so that's a big issue that we have with a lot of this, is that there's really no real enforcement of most of these requirements. So we don't have a safety, the safety police are not going to come to people's businesses and say, show me your plan. But people do have plans, and people are doing good work that are already open. Shoemakers is an example. The recycle shop is a really good example of that. But so it's really the individual business's responsibility to have their plan and protect their workers and protect their customers. That's going to be, I'm sure, some of the concern that businesses are going to have in regards to reopening, is they're going to have, everybody wants to reopen, but they want to do it safely. So again, they can reach out to our group that's helping with looking at plans and giving people some guidance in regards to those. There's lots of information that's come out from the chamber. And I suppose the enforcement piece in regards to safety would be what I had talked about before. If we have let's say we have a hay company that has a person who's positive, or 2 people that are positive, we would be coming out to that hay company and saying, okay, well, let's see what you're doing. We would do testing of a lot of people that were in that facility and try to help them at that point of saying, okay, well, this didn't really work because of this, this, and this. How can we change that to make that better? So I guess that's not really truly enforcement, but that's helping businesses on the back end to determine what they could be doing better.
So just to add to that, Mark, for conversation, wouldn't you say that that's probably going to be moving forward? So like businesses like restaurants or health facilities that get a regular visit from the Department of Health, they could potentially do some support services of how they're maintaining their safety plan and just having good conversation with businesses that may come into their regular inspections, correct?
Yeah, that's a great thought. We will be taking for example, our food inspectors will be adding that mostly just as a service, right? Mostly as well, maybe you should be thinking about this. And so, we do have the ability to reach out to businesses that have permits, and it certainly would not be done in a punitive way at all. It would be done in an educational way. So we have added that to their workload.
Sitting on one of the technical review teams, we have had a question quite a bit about, is there a way that we can do consumer trust by putting a flyer or a window cling or something inside the windows of the businesses that want that trust for consumers that they have done a safety plan of their own, or they're acknowledging that they have to do some things differently? Have you had any thoughts in regards to that?
Yeah, I think that's a good idea. The only thing I've seen in that regards here in Ellensburg I'm going to call out again the recycle shop, who have some signs in their window that says you need to knock on the door or text us to be let in, and you have to wear a mask. And that obviously indicates to people that they have a safety plan. I think if people have a website, that's another good place to put that information out, because most of it, you know, businesses are wanting to let their customers know that they're protecting them and that it's safe for people to come out and, you know, haircuts, for example, barbershops are in phase 2 of the safety plan, of the phased approach to reopening Washington. So if businesses can communicate those things to their customers, that they're looking out for their safety, then people are going to feel comfortable for coming out. Absolutely.
And for those on the call, on the Chamber's website, we've really been working hard as a staff to provide some toolkits and some reference points. And so we have some really good information on our website. If you go to the website, there's a link up on top that says business support. And in that business support, you'll scroll down about a quarter way and you'll see a business toolkit. You'll have the WorkSafe product that we created that Mark's been talking about. There's about 32 business industry suggestions for safety planning. It also goes over the proper use of PPE and washing of your hands and sanitizing. So it's really good information for you if you haven't seen that already. And additionally, we also have signage. There's some printable signs that are available. So once you start getting into preparing, just like the recycle shop, you may want to have educational hand washing signs just to remind people how to properly hand wash, or how to put on a PPE or a facial cloth covering. So those are some things that are on our website already. We'll move to question 3 for you, Dr. Larson. Why did you determine so early that CWU should cancel events such as graduation that were at the time 3 months away? And in addition, why did you think the guidelines imposed on CWU should be more long-term and restrictive than any other university in the state system?
Yeah, and I finally figured out the Zoom thing. Last night was the first meeting that I've actually had on Zoom. Unlike you, who WebEx was a new thing, Zoom was a new thing last night for me. So now I can actually hear you, and I put my picture back on. So
okay.
So that's I had a little heartburn with that question yesterday, but I'm going to go ahead and answer it anyway. So in conjunction with Central Washington University President Jim Guadino, that decision was made. So that was not a unilateral decision to not allow the students to come back. So when the governor closed schools, initially in the governor's, which I think was like at 12:30 on a Friday, at 12 o'clock on a Friday, in his plan was still to close all colleges and universities and secondary schools and those type of things. And then when it came out, it was, well, everything except for colleges, which our students had left. 9,000 of those students live on the west side of the state that were in areas that were a hotbed of outbreaks of disease. And I spoke with the governor directly about this, as I did speak to Jim Guadino, and it's perhaps been the hardest decision that I've had to make among a lot of difficult decisions. But that decision to not allow Central students to come back was my decision that was made in conjunction with others, but was my decision that it was not safe for our community to have students who have left here and were over on the west side of the state to come back to Kittitas County and make us a hotbed of disease. It's always hard to know whether decisions we make are the right decisions or the wrong decisions, and history will sometimes prove us right or wrong. Sometimes it won't prove us right or wrong, but I would say that if you look around us, and being the only university that the only county that said the colleges can't come back, our numbers are low. And I think that played a role. The university themselves made the decision to not have graduation, although that was in the health order that said they had to be closed through June 30th. That could have been a negotiation or a discussion that they could have had going forward, because health orders can be modified, as we will have to modify our current health order. If we go into phase 2 of the reopening plan, our health order would not allow that. And so as soon as we get a go from the Secretary of Health, we will modify our health order to be consistent with that. But they had to make plans ahead. It kind of goes along to the next question. They had to make plans ahead as to what they were going to do. That was the decision they made. But the decision to not allow the students to come back was my decision based upon epidemiology and what was happening with the disease currently.
Wonderful. And I do know that a few of the participants today may have to jump off a little early. So I'm going to jump to a question that came into the chat because I think it's a little bit fitting, and then we'll move back into the pre-questions. Is it possible for a business that wants to elect to test their staff, their core staff, prior to reopening, is there an opportunity for them to do that?
Yes. It's tricky. It's not tricky to do the testing, right? So we have enough testing. But if you're testing for acute disease, if you're testing for somebody who might be an asymptomatic, who have the disease but they're asymptomatic, and you test 10 employees, and they're all negative, are you going to test them again next week, or are you going to test them again next week? So that's one of the issues, is how often are you going to test and who are you going to test? The other issue is that if you test employees, then you need to put them in isolation until the test results come back. And currently that's 2 days. And then if those people are positive, then they're in isolation for up to 10 days. It's 7 days plus 72 hours. But so there's the tricky part of that. So that's the nasal swab testing for acute disease. And then the other good part of that question is the blood testing, is everybody wants to know if I have antibodies to the disease, and it's the serology testing. And right now, we are not using that serology to determine whether or not people can go back to work, because we can't tell you if you have a positive test that's a positive test due to having COVID-19 or any of the other coronaviruses. So that's one of the problems. And the other problem is that because the disease is so new, I can't tell you that if you have a test, even if it showed that you had COVID-19, that you have any immunity of getting that again. So it's tricky. It would not be my recommendation, although we are in discussion of possibly testing all people in, for example, in a specific industry like nursing home workers, because we know that the way diseases get into nursing homes now, especially since we're not allowing any patients' families to go into nursing homes, it's the staff that brings it in. And where do they bring it in? They bring it in from the community, because we're out and about. So it can be done. It would have to be done. I mean, if somebody is interested in doing that, they should email me directly, and I can talk through those people, the pluses and the minuses, and what they're really trying to find out.
Okay.
That's a great question.
Well, let's go to some next good ones here. So given the future remains largely unknown, shouldn't we just sit tight on any decisions about the various events of the fall, starting with the rodeo and fair, keeping in mind that once a decision is made, you cannot uncancel an event?
Yeah, well, that goes kind of right along the lines of Central's choosing to cancel their graduation. You know, businesses have to look ahead. So one business that looked ahead was Jazz in the Valley, and they said, okay, well, we have to do all this work to do this. And nobody called me and asked me that question. My guess is somebody on that board who has medical background said, well, I'm not sure this is really going to be possible, and they looked at it financially and decided that the best thing to do would be to cancel. I don't have a crystal ball like anybody else has a crystal ball, and people ask me that question all the time: should I cancel this? Should I cancel this? And that's a business decision. I can just tell you that if you look at the phased approach into reopening Washington, there are some dates that are kind of ironed into that plan, and those are ironed into it based upon science and biology of disease. And so currently, each one of those phases is 3 weeks, more or less, but 3 weeks at a minimum. And if we go, one of the advantages of going into phase 2, I mean, there's a lot of advantages of going into phase 2, but there's some disadvantages too. But one of the advantages of going into phase 2 is that if we do a really good job of helping people that are sick stay at home and not spreading the disease when we get them, then we will most likely, although there's no promises from the state yet, we will most likely be moving into stage 3 earlier. And if we do a good job with that, stage 4 earlier, which if you look at that, it still takes us, I'm pulling out the form here, it takes us to the end of June before we're realistically, so this is May, June, the end of June before we're going into phase 4, which allows gatherings of greater than 50 people. So, and so there are certainly some dates built in that businesses are going to have to say, okay, well, I need to make some decisions now. The rodeo is a big one of those decisions. And I was talking to Brett the other day about this. They have to make decisions about, well, if there's social distancing requirements, is that really financially feasible to have a rodeo, and those type of things. And those are outside of public health. Those are business decisions. But things like the fair, I think people that run those events have to be saying, okay, what is the likelihood that I'm going to be able to do that? Colleges are looking at that. What's the likelihood that I'm going to be able to open all my dorms up to full capacity, or am I going to have to only have half capacity so I can put some people in isolation if I have to, or how do I maintain social distancing and those type of things. So what I can tell you for sure is that we will have restrictions of social distancing measures throughout the summer. There's a really good article on the New York Times today about vaccine development, and it has some sliders from today, has some sliders in there. If we do this, then how much earlier can we have the vaccine? If we do this, if we start manufacturing the same time we're doing clinical trials, and even in best of circumstances, barring a miracle, that takes us to February for vaccine development. So we know that we will have some social distancing things in place until we have a vaccine. And so I just think businesses need to plan for that. Do they have to cancel things? No, but sometimes it's hard to cancel things at the end too. I'd like to say everybody can do everything, but I think it's unlikely.
I think an added comment to that is currently the Chamber is holding some event committee meetings. We invite you if you would like to join us. That's Monday at 10 o'clock for the event committee meetings. We do have a subcommittee that is reviewing a little bit more details of coming into an event specific plan and safety plan. So the rodeo, the fair, and some smaller events are on that Zoom call. But I think it's interesting because when event planners start thinking about this, especially in a business sense, they have to determine the health capacity of their event, right, within the social distancing. But there's also the psychology of consumers. They have to have that comfort level again to be in the events. Like we were looking at it from a perspective of, all of us were comfortable with 60,000 people in a weekend for fair and rodeo, but how many of us will be at the same comfort level that we used to be? And that's just that psychology change of,
Yeah,
of it.
that's totally correct, and it's going to be difficult. You know, how many of us are going to go to Burning Man again? You know, how many of us are going to go to the Gorge to go to a big concert? How many people are going to, you know, be 60,000 people in a football stadium? There's just a lot of pieces. Even if the risk is low, we as humans perceive risk differently. Some people say, well, the risk is high for me, so I'm not going to do anything. That's the reason that as a business, you should get in front of this and say, I'm going to put stuff out on my website saying what I'm doing to protect you. I like that idea of signs, and I'll bring that up with some of our folks in public health. I'm on a call tomorrow about whether or not there's a way to have a approved by public health type of sign that people can put up, kind of like what we do with restaurant safety. But I think, you know, we want people to know that they can get out and do things. And as you know, I tell people, I mean, I tell people one advantage of this opening early, or this to the phased approach, and also to COVID-19, is that maybe we will all shop locally more, because we don't really want to go out. We don't really want to drive to Costco and shop in Costco. So, and I talk every day about people staying at home. So maybe an upside of this is when all the carnage is done, maybe people will actually be shopping here more locally and buying stuff, like at Gerald's instead of ordering it on Amazon. So yeah, that would be my hope.
We had a question that came in, so it's off of the regular sheet that we had, and I think it's important to address it. So when you talk about the vaccine, does that mean kids, grade school, middle school, high school, probably won't return to school until the vaccine has been released?
No. I think everybody realizes that school is important, but it's going to be tricky. So the nice thing for kids is that they haven't really been hit hard by this disease as far as an illness go, but we do know kids are transmitters. But they're going to have to really figure out social distancing things in school. There may be, I haven't talked to Ginger lately from Ellensburg School District, but I know they've been looking at, well, are we going to do shift? Are we going to spread kids out and do more shifts? Are they going to do some online and some in person? They have a lot of work to do to figure this out. But I truly believe that secondary education will be happening, because otherwise their businesses will go out of business. So I think universities will figure it out. And I think public education and K through 12 is going to have to figure it out, because otherwise all of us can't be at work. If our kids are not, or if our kids are still at home, then adults can't be at work either. So I think they'll figure it out. But no, school will happen before the vaccine's out, for sure.
Well, good. I'm glad they asked that question today. The final question that we have, and again, if those that are on the call want to put a question on the chat, we are welcome to do so. But how will you track and quarantine people that test positive after phase 2?
All right, so that's required by public health, regardless of what phase we're in. So that's not a phase 1, phase 2, phase 3, phase 4 thing. That's, I mean, when somebody, I'm going to use a sexually transmitted disease as an example. We do that all the time with chlamydia, for example. Chlamydia is a sexually transmitted disease. It's a reportable disease to public health. We try to figure out who's at risk from that particular person and how to get them treatment. So that's typical case and contact investigation. Isolation and quarantine is another step beyond that case and contact investigation, but it's still a typical public health process. So we look at that with tuberculosis, for example. We haven't had very many cases of tuberculosis in Kittitas County, fortunately, but we have had a couple during my period of time as the health officer, and tuberculosis is a very easily transmittable disease, and one of our people that was positive was not able to take care of himself at home because he had a whole bunch of people in his home that were at risk. So we ended up putting him up in a hotel until he was not contagious anymore. So with COVID, we're going to have a lot more people that need. So we're going from using a big shotgun approach, which everybody has to stay at home, to an approach where we're just encouraging people to stay home when they're sick. So, but to have the second part work, which is phase 1, phase 2, phase 3, phase 4, we in public health have to do a really good job with that. And let's see, I'm going to come back here, maybe. Yeah, there I am. We are going to do a community kind of approach to this. So the first step is we're going to encourage people to stay at home. I mean, if people can stay at home and not put other people at risk, then that person is going to be encouraged to isolate themselves at home. Isolation is for those people that have the disease. Quarantine would be people that are at risk of the disease. So for example, if I was positive, I would be isolated at home, but my 3 family members would be quarantined because they're at risk. So that's the difference between those two things. So the first step would be to encourage people to stay at home and provide wraparound services for those people. So we are required in public health to help people figure out how they're going to get food, how to get social interactions, if they need internet access. All those things are things that we're required to provide for those people. So that's the first step. We're going to work with, I'm going to use Central Washington University as a good example. We're working with partners. So Central Washington University will be isolating and quarantining all their own students. So they're providing those same services to their students. They have that plan in place. We're going to work with churches, with large businesses to say, okay, well, if you have an employee who's positive, what options do you have as an employer to be able to help that person to stay at home and stay healthy? So, and then the last step would be using some type of, we're already working with homeless population. We have some contracts with some of the hotels that will allow us to put people who are homeless that are at that have COVID-19 up. So we have that. We have a commerce grant for that, and we have the ability to use what we call push packs from the state, which are basically kind of pop-up isolation and quarantine facility. That would be our last option, but we may have, you may see some trailers actually down at the fairgrounds should we have a large population that doesn't have a place to go. So, but the key really is that we're really going from everybody has to stay at home to we're going to help people that are either positive or at risk to figure out how to stay at home so the rest of us can stay healthy and the economy can keep moving forward.
This question I'm going to just bring up for myself, because as I'm preparing the events, the community events process and the mass gatherings, I think about, you know, we're surrounded by several counties that are continually getting new cases of COVID-19. And as we reopen into phase 2, one of our larger industries, which is tourism, we're going to have that flocking possible happening, especially for outdoor recreation and some of those experience-based activities that go along with those that come out to the outdoor recreation. Mm-hmm. Do you have any recommendation for our tourism-related businesses? Because I get questions almost daily now in this conversation of, can they or do they have to service people that are not Kittitas County residents? And, you know, just those business decision questions, but do you have any suggestions for them with the potential of people not staying to essential travel?
Yeah, that's, so we could have said, so I, as the health officer, could have said, no, I do not recommend having a variance. So that was one option. The other option was the one that we took, which is, yes, we want a variance. And the middle option would be, we want a variance, but we're going to take certain things out that we think are too high risk. And one of those things in phase 2 is camping with 5 people outside, fewer than 5 people outside your household. And I debated that one. And that mostly affects the upper Kittitas County, but it affects all of us down in lower counties as well. And we decided not to kind of carve that out, but it is a concern. We're going to be looking at data, especially with, should we start having big numbers that turn out to be positive in the upper county, because that's what that case and contact investigation comes from. So let's say somebody at a grocery store ends up positive, and then we test a bunch of people around them and they're positive, and we figure out, well, that really came from somebody who came over from, I don't know, Kirkland or somewhere. Well, then we might consider rolling back that particular piece of saying, okay, well, we're not going to allow camping in Kittitas County. We are doing some other educational things. We're going to be using the reader boards out on the highway to encouraging people to stay home. I brought up the idea of closing the eastbound Cle Elum exit, but I mean, there's those kind of things that we can do in certain situations, but most of the time they're not very wise to do those things. But I am concerned about that. And as a business owner, so let's say I was a business owner in upper Kittitas County, I would be really paying attention to signage on my door saying, you know, you are welcome here, but you're welcome, but you need to wear a mask, right? You need to have masking available to really do those things. It's, you know, we have no ability to, you know, we have to be very careful with saying, well, you're not from here, so you can't get your hair cut here. But that's been brought up as well. And my biggest concern about the variance request is the fact that we are surrounded by counties with really high numbers, and we're right on the highways between those counties. And people are dying in Yakima had, I think, 3 more deaths over the night, right? And so, you know, we have to remember to be kind. We have to do things to protect our customers and our employees. And, you know, this whole isolation and quarantine piece and the whole case and contact investigation piece that people are really worried about, it is not a big deal. It is not, you know, we are not taking away people's rights. What we're trying to do is allow the majority of us to be out and about and doing our thing, and just helping those people that are sick to stay at home, so the rest of the people can be out and about, and that person can be out and about in a short period of time. So people have a lot of concerns about that, but I have more concerns about people's concerns about it than I do about the procedures themselves.
Yeah, and I would say, especially when businesses are doing their safety plans, that they really should focus on the educational standpoint, educating those consumers that are coming into their door what their preference is. And so I think that's a huge key, especially for the tourism related businesses. I kind of chuckle a little bit, and Steve Townsend is on the call, so he'll chuckle a little bit, but I come back from a hospitality industry experience, and I saw just recently Trump administration has some scientists that are creating these fog machine type of sanitizing machines. And the hotel industry has had one of those types for a long time, but we usually used it to remove cigarette smoking from non-smoking rooms. And it's interesting that they're using the same component, but then putting a sanitizing fog to get rid of some of the viruses that could potentially be in areas. So I think it's very interesting that tourism had already been there and done that from a cigarette smoking situation, but they're reusing those type of machines. So,
I think people are trying their best to come up with ideas, and it's all, you know, I think everybody is trying to solve the problem in their own way. I think everybody's concerned, and I think everyone is concerned with health. I don't think anybody says, well, I think money's more important than health, and I don't think we think health is more important than money. It's all really related. And so, I mean, maybe one of those people that are trying, you know, there's a lot of people at home with lots of time to think currently. And so one of those or multiple of those people could come up with some ideas that are really helpful. So.
Yeah. Well, we usually give about 30 to 45 minutes for these information calls. I'll give one last call out to those that are participating. If you have anything or have a question for Dr. Larson, we'll do that here. But if we don't see anybody, we will sign off for the day. And we appreciate all your efforts, Dr. Larson, and your team that surrounds you. I know you're making some very difficult decisions, and we appreciate your thoughtfulness behind those decisions. So last call for anybody that may have a question.
I do.
Okay, and who is I do?
This is Joanne Harris, Ellensburg Pasta Company.
Hi.
My question is, I've heard that, first of all, I want to know if it's rumor, if it is legit, that one method of monitoring who has been in your facility is that people will need to sign in that they have been in your business. Is this something that our county is looking at as a safety practice, as a requirement? Is this even legal to have people do this?
So that's a myth. Although some places do that. So for example, at the Emergency Operations Center, we sign in every day and we have our temperature checked every day, but we're working here, right? So we're, you know, every rumor has some basis in truth, but we are not going to make people have a list of clients that come in. Now, the basis of truth of that particular thing would be, let's say your restaurant, let's say one or two of your staff end up having COVID-19. Well, then we would be coming in and saying, okay, could you give us any idea who might have been here that day? Any idea who might have been served by that server, those type of things. But that would not ever be a requirement for you to keep a list of that. It would be helpful for me in public health, just like if somebody at, I don't know, Twin City Foods, for example, got sick and if they had a list of all their workers, mostly what we would be asking you for is who was working today, because the actual transmission of COVID-19, although it's easily transmittable, you have to be within 6 feet of somebody for 10 minutes or longer. And, you know, somebody serving me food, even at the best of restaurants, is not around me that long.
Okay. And then one last question from us. The topic of masks. Will masks be in a restaurant something that you advocate that workers are wearing?
Okay, well, I'm willing to wade back into the mask thing again. So that's kind of one of those errors that I made at the beginning. I think when the CDC came out and President Trump said everybody should be wearing a mask, even though he said he wouldn't wear one, I think the best thing at that time would have been for me to say everybody should wear a mask. So I am not, unless we all of a sudden have hundreds of cases in Kittitas County, I'm not going to mandate masking in Kittitas County. So it'll always be an ask for me. You will always see me outside wearing a mask. And unfortunately, I've kind of attempted to drink coffee through my mask because I forget that I have it on. So, but you'll see me with a mask on all the time. So as far as protecting your, masks are better, cloth masks are better at protecting others than they are protecting ourselves. So the hospital has taken the approach of everyone that works in the hospital is going to be wearing a mask to show others that we're protecting them. Everybody in public health is going to be wearing a mask to show that we are protecting the public. The only reason it would come into a safety plan, for example, at a restaurant, would be if you had some employees that couldn't maintain that 6-foot social distancing, you might have to say, well, we're going to wear a mask to do that. So that might fit into your safety plan, and you might, as a business, say, I think we will be more, we will be showing the public that we are protecting them better. So, so we, as a business decision, are going to be to be wearing a mask because we want to show people that we're protecting them. But I'm not ever going to mandate that in Kittitas. Well, I'm not going to say never. It'd be unlikely that I would ever mandate in Kittitas County at this point that everybody had to wear a mask, because I think it's probably not doable unless all of a sudden we have 1,000 cases and then we have a bigger problem than just masking.
Thank you.
Yeah, there's been some really good questions today. It's always tricky for me to answer all questions on the fly. And so if I say something that doesn't seem to be quite right or you don't quite agree with, please have people reach out to me. I mean, my approach is to tell people what I know and to be totally honest and transparent. So even if I'm uncomfortable with a decision that I've made in the past, I promise I will always tell you the truth.
Well, I have seen that in the many interactions that we've had, especially the 12 o'clock calls with Commissioner Waxsmith and then all of your daily reports. So again, we really appreciate your efforts and your team. And it looks like Mandy Olson from your team or from the EOC has also replied some information in the chat. So Joanne or anybody else, just look at the chat and her comments there. Again, appreciate your time. One last call for anybody that wants to ask a question. Seeing none, thank you again, Dr. Larson, for joining us, and thank you everybody for participating. Have a great day.
Have a good day. Thanks. Be kind.